Right, so I see we have our attendees starting to trickle in here and fill up the room. So I think now is a good time to go ahead and get started with things here. So thank you everyone for joining us today for what should be an amazing webinar. We have such great speakers to talk about this critical topic of human rights violations against people who use drugs in Africa. For those who don't know me, my name is Jake Agliata. I am the Policy and Communications Officer with the International Network of People Who Use Drugs. And I'm really excited to be facilitating this webinar for you all today. We're gonna have our first speaker, Richard from AfricaNPUD, give opening remarks in just a minute. First, I want to just go over a couple of basic ground rules for the webinar and give you a sense of how you can participate during the end and throughout as well. So first things first, I know we said that we would be having French interpretation for this webinar today. We're still hopeful to be able to provide that for you. Unfortunately, our French interpreter has not been able to join the meeting yet. So we were just waiting on him to join, and at which case we will set it up and you will be able to click on your bottom toolbar on Zoom on interpretation and click the French channel if you would like to be listening in French. I do apologize again that we're not able to do it immediately at this time, but hopefully we'll be able to switch over very soon. Second, just a reminder to all attendees you should not be able to unmute yourselves or turn your video on without our permission to do so. But if some reason you find you can, please do keep yourself on mute, keep your videos off, especially while our speakers are talking, so we don't have any interruptions or any sound in the background. And finally, we do plan on having time for question and answers at the end of the webinar today. Just to speed up that process and to make sure that questions can be answered, we encourage you to submit questions using the Q&A function at the bottom of the Zoom toolbar. You'll see it down there. You can just type in a question and we can answer them in real time. You can also make comments or ask any questions you would like in the chat as well. And we do encourage people to use the chat to go ahead and introduce yourselves now, where you're calling from. If you're a member of an organization, let us know who you are. Get to know each other a little bit. So without further ado, I think we should go ahead and kick things off here. So I just want to first pass it off to the other principal organizer of this webinar, Richard Nininahazwe, who is with the African Network of People Who Use Drugs, and he's going to give some opening remarks and talk about what we're going to be discussing today. So Richard, whenever you're ready, please go ahead and begin. Richard, you are on mute.
Thank you, Jack, for the floor. Distinguished participant or protocol observed, good afternoon. Thank you for your support and your time to participate in the webinar. According to the 2021 World Drug Report, there are an estimated 950,000 people who inject drugs in Sub-Saharan Africa, with numbers expected to increase till to 150% by 2050. HIV prevalence among people who inject drugs in the region is estimated at 11%, while the HCV prevalence at 20%. Global research demonstrates the links between the criminalization of drug use and possession and HIV and HCV incidence prevalence among people who inject drugs, making more evident than ever that health impacts are shaped by social and political dynamics. Drug policy in Sub-Saharan Africa follows the same misguided path as global drug policy. People whose drugs are simultaneously targeted, hunted down, tortured, and ignored as a result of the global war. Numerous human rights violations are perpetrated against people who use drugs in the name of the war on drugs, including but not limited to the right to health, right to freedom from violence, arbitrary detention and discrimination, and right to participation. In order to address human rights violations against people who use drugs, it is imperative to start by increasing awareness and visibility of this right violation and specific characteristics they take within the Sub-Saharan African region, which cannot be understood without directly listening to people who use drugs themselves. The global COVID-19 pandemic only highlighted the structural inequalities and both compounded and expanded the lack of protection for the community. It exposed people who use drugs to increased violence, including from armed groups, arbitrary arrests, and detention and sexual assault. COVID-19 related lockdowns and curfew in several countries were linked to a higher number of cases of gender-based violence against women and girls who use drugs, who also struggle with access to legal aid, justice, and well as health and counseling services. This webinar, led by African Network of People with Drugs in coordination with International Network of People with Drugs, will highlight the growing movement for drug user rights within the region. During the event, a landmark report by AfricaNPUD on human rights violation during the time of COVID-19 will be launched with the goal of informing future drug-related laws and policies and enhancing and strengthening human rights education programs in Africa. I would like to end this by thanking all support we get from all our partners. Special mention to INPUD, International Network of People with Drugs, our mother networks, RSF. Special mention also to Vocal Kenya, our fiscal agent, and a very big special mention to in-country networks which made this happen. You guys shall be proud of yourself. Thank you.
Thank you so much, Richard, for that wonderful introduction, and thank you for the message of support as well. It's been so fantastic to work with AfricaNPUD on not only this report, but so many other things, and seeing the network grow is such a great thing to be able to see that from the movement and from the global perspective as well. So thank you for the introduction. So let's move on ahead to our next speaker here, which will be Christoforos Mallouris from UNAIDS. Christoforos is Senior Advisor for Equality and Rights for All at UNAIDS. He's going to be talking a little bit about what UNAIDS is doing to defend rights for people who use drugs in Sub-Saharan Africa, how UNAIDS supports communities in the region, and make some links and draw from the recent social enabler targets in the Global AIDS Strategy and the Political Declaration. So please, Chris, whenever you're ready, you have the floor.
Yep. Thank you. And I probably won't take it the entire 10 minutes. I feel what I'm talking about is a no-brainer. What should be done now? The
Chris, I think you might be having some internet connection.
First, formal interaction with AfricaNPUD, and it's wonderful for opportunities. Sorry about that. I'm in a hotel. Is it better if when I speak slower? So is it getting any better? I'll turn my video off. That's okay.
Yeah, we can hear you good now.
Can you hear me?
Yes.
Okay. Sorry about that. I'll start again. I won't take the entire 10 minutes. What I was saying is that there should be a greater collaboration between UNAIDS and networks of people who use drugs in Africa. It's great to see the African network of people who use drugs running, and I look for possible collaborations with them in the near future. We have some ideas of what that could look like, but it's great to see. We are. I feel that our collaboration with networks of people who use drugs and UNAIDS has been lacking in the region, so I'm being upfront and honest about it, and I think this is a great opportunity to change that trajectory. We should be providing support to people who use drugs, just like any key population in the region. ways of doing that is through being advocates for inclusion of people who use drugs, participation, as well as services within global fund grants, PEPFAR grants, national strategic plans. Any process that happens at the country level should have the participation of people who use drugs in it, and service provided for people who use drugs in an acceptable and an accessible manner. Also doing advocacy together, a key opportunity for us to collaborate on advocacy that continues to marginalize and exclude people who use drugs from the basic right to health and human rights. We should be able to facilitate, as UNAIDS, access of people who use drugs within national processes. You need to be part of the discussions that are happening to elaborate PEPFAR COPs, on how to monitor and implement global fund grants, on how to formulate national strategic plans that include your needs in the center of the response, and any other processes that are happening at the country level that you should be part of. As I said earlier, we are not doing well enough, and I think we should do better. I call my own organization to improve its collaboration with people who use drugs. As part of the 10-10-10, as you know, there is the people living with HIV stigma index that's being implemented across the region, and ensuring that people who use drugs living with HIV are part of that discussion and part of the responders to provide an insight as to how being a key population living with HIV is disproportionately affecting the quality of life of people who use drugs is going to be really important. So I look for possible collaborations with national networks in order to make that happen. We have another initiative in progress, which I think would be great if we can collaborate with people who use drugs networks. We are working with regional networks of key populations to develop standardized, simple, easy to implement evidence gathering toolkits for country networks on the level and quality of access to HIV, SRH, and broader health services. This would allow networks to start engaging in UHC processes and then use the right to health as an entry point for broader human rights discussions at the country level and the regional level. The 80-60-30 targets, or 30-60-80, however you want to say it, also provide an opportunity for us to collaborate. We are more efficient, they're more effective, they're also more acceptable and can reach people who are most left behind, which in this case, the case of people who use drugs, unfortunately, is a good example of people most left behind. We need to, as UNAIDS, we need to learn from you. We need to learn and harness lessons learned from you, those examples across the region as well as across the globe. So I just wanted to share just those few words that and be honest that our collaboration has not been primal. It has to be more centered. I look for more opportunities to engage with you in both as advocates for as UNAIDS as an advocate for your rights, collaboration in joint advocacy, facilitating in your access to processes that you should be at the table, and we need to support that, and also to highlight lessons learned from your work, whether it's community-led service delivery or advocacy. We need to be your partners. We want to be your partners. And I'm really glad that the African Network of People Who Use Drugs is now operational, and we want to collaborate with you more strongly, both at the regional level and at the national level. Thank you.
Thank you so much for that very strong call for cooperation and collaboration. It's great to hear UNAIDS speaking about working with people who use drugs and working with the broader community of people who use drugs throughout the region, and hope that this could be a launching platform among other events to get that started. So thank you very much for being here and speaking on this. So our next speaker was intended to be Happy Assan, who is the Executive Director of the Tanzania Network of People Who Use Drugs. Unfortunately, I've been informed that Happy is having some internet connection issues, has not yet been able to join us here. So we will hope that she's able to resolve those and join us before the hour is up, so she can give us a perspective on human rights among people who use drugs in East Africa, as well as a perspective of women who use drugs. But while we were waiting for her, why don't we go ahead and move along to our next speaker. And sorry, just before I do real quick, I want to remind everyone, please, if you have questions to submit for our panelists that we can address at the end of the webinar, feel free to add them to the Q&A section, add them into the chat, however you want to submit questions. It's always easier for us to have questions beforehand so we can be sure we address all of them and to the appropriate speaker as well. So if you have questions, please feel free to be contributing those as we move along the agenda. So as I was saying, since Happy is not yet here with us, why don't we go ahead and move along to Rita Musa, who's the National Secretary of Drug Harm Reduction Advocacy Network in Nigeria, another drug user organizing network in West Africa. And Rita is here to give us a perspective on human rights for people who use drugs in West and Central Africa, with a focus in Nigeria and the work of her organization's community-led responses to rights violations. So Rita, whenever you are ready, you have the floor.
All right, thank you very much, Jake. I don't know if you can share my slides on your side. If not, it's still fine.
Sec.
Is it possible?
Yes. Sorry, I have them right here. Should be see them now.
All right, great. Hello, everyone. I especially want to thank INPUD for a platform like this, for creating platforms for African countries, networks who use drugs, to actually have a link and constant open forum for communication. So like Jake earlier said, I'm presenting on the perspective of human rights for people who use drugs in West and Central Africa, with a focus on Nigeria, which is my country, and the work I do with Drug Harm Reduction Advocacy Network. Okay, next slide, please. In West Africa, most West African countries have policies and laws that criminalizes drug users, and very few of these West African countries, as we all know, are practicing harm reduction. Some of the similarities, next slide, so that I'm trying to work with my 10 minutes here. The next slide, okay. Some similarities that were found in West African countries as regarding rights violation. We have policies and justice systems do not protect people who use drugs. And there are inadequate funding for people who use drugs. There's no harm reduction programming. In most of these countries, there's limited understanding of the gender context of drug use. Drugs in itself, harm reduction is still abstract in some countries. And there was a survey that was carried out on torture and ill treatment of drug users in West Africa by West African Drug Policy Network. That was in 2021, early last year. Now, this survey indicates that people who use drugs are routinely subject to physical, mental, sexual violence in the hands of law enforcement in West African countries. Some of these abuses could be death threats. There are beatings, there's to extract information, extortion of money. This is usually done by law enforcement agencies. In Nigeria, precisely, we have the police, law enforcement, and then there are other like the SARS and other people just looking for means to extract money and then incarcerating unlawfully. Then we have the judicial sanction, in which imposes corporal punishment for drug users. There is no threshold to the drug you are found with, or the there's no description as to what exactly should be incarcerated or what exactly deserves punishment in this country. Usually just being a drug user is enough to be incarcerated. And then you have in prisons, you find out that there's constant beating, there's sexual abuse, there's threats of rape, isolation, forced labor. Most times what they do is they arrest people just so they can populate the prisons and then increase their workforces. They just maybe come, like during the farming season, they release a bunch of people that have been arrested unlawfully, like to all these wealthy farmers and stuff. They use them for labor, which is absolutely a human rights violation. Next slide. Okay, West African countries like Cameroon, Togo, Senegal, they show very minimal or less involvement with human rights services for people who use drugs. There's barely any harm reduction practices in some of these West African countries. Like for instance, in Ghana, they were able to legalize cannabis for medical and industrial use. That was in 2020. It was passed on, but the situation with drug users, inhumane treatment, the stigma, and then the unlawful incarceration is still ongoing. In Nigeria, the Human Rights Act do not protect drug users in any form. The government and policymakers, they show no meaningful involvement, although there are conversations about this, like NGOs, networks keep bringing this up. There are, evidence showing how people are being violated, but the conversations always get to a level and then it stops there, but there's no evidence of actually making a difference or changing the narrative. Next slide. So I'll rush down to some of the things that we've done, like in the organization. And this is just a symbol, like the war on drugs has led to most of all of this. We have human rights abuses, we have racial disparities, we have over-incarceration, the list goes on. Next slide. Okay, just a little on the legal framework in Nigeria. In Nigeria, the legal framework is controlled mainly on drug use, is mandated only to the NDLEA, which is Drug Law Enforcement Agencies in Nigeria. They have there's an NDLEA Act that was an NDLEA Act in 1989. That was the last time it was revised. It establishes that NDLEA is solely responsible for all drug use, all illegal drug use activities in Nigeria, which means NDLEA has the right to incarcerate drug use. They have the right to any lawful decision that is made concerning drug use in the country. Now, the Act criminalizes any kind of activity. Could it be use, could it be production, processing, in any form, sales or use. And all of these forms of drug use activities are all penalized. They all have the same penalty of about 14 to 15 years imprisonment, which is something that it's still an ongoing conversation. We've been having this conversation about the NDLEA, the Federal Ministry of Health, trying to get a threshold, knowing the difference between the users and the distributors, and the evidence we have on how well harm reduction has saved lives. Let's go to the next slide. Okay, for drug harm reduction, that's okay. I think we can skip this slide. Let's go to the next one. Yes, thank you. Now for the network of drug, the Drug Harm Reduction Advocacy Network in Nigeria, which is a network of drug users, comprises of organizations around the country that work directly with community members, people who use drugs. Now, in the era of COVID-19, the organization had a collective, held a collective community consultation where we had all key populations, key affected populations. That we had the MSM group, the FSW, we have the other LGBT groups, and then we have the people who use drugs come in a consortium. We had discussions about some of the human rights violations that have been going on and how COVID-19 has increased some of these things. Now, from this discussion, all that were parts of this community consortium were able to bring out some of the reoccurring things, reoccurring issues in our communities. Like here, I listed a few out of the many. We had reduced community awareness on HIV due to physical distancing, and then the lack of COVID-19 IC materials, which was something else. There was decreased adherence to treatment due to restriction, higher cost of service, stock out of HIV prevention testing, treatment commodities, and this happened when people could not access HIV services, and then the service providers as well could not come into the community. And then we also had issues where some service units, like clinics where people go to access their service, were on lockdown, like they were locked down throughout the session. So there was a lot of backlashes and so many community issues came up. And then we had the increased mortality rate due to the lack of access and affordability of service, limited access to KP-specific community-based prevention care and services. Now, this was something that all the population experienced. The services were not coming and you could not access or go out to access the services. And then this also led to the increased rate of mortality, because for some community members, that time that they used to sit around with their community members to associate with other people is what maybe keeps them going, because during the isolation, a lot of people were found dead, being in lockdown, some were missing, and then a whole lot of things went south. And there was increased cost of incentives provided by community members. Some of these incentives that were meant to be free because of the COVID-19 era, and there was a lot of people needing food and other stuff, people started selling commodities, and then commodities were hoarded. Some kept it, just for themselves. And so some of these things were listed out during this community consultation. There was increased arrest, like we have it in all the West African countries, and I think almost around the world, there was increased arrest. The law enforcement were just arresting for all sorts of issues. And then most especially in the drug user community, the arrest was unbecoming, because just seeing you on the road, seeing you with one wrap of cigarette, just looking at you, there's this facial, they believe there's drug users have a facial appearance, just from just looking at you, there's that assumption it's a drug user, let's take him in. And then that was just it. There was just a lot of violence going on. And then I worked with a women-led and focused organization, drug user women-led. We had a lot of cases around intimate partner violence, like because of the lockdown, let's say people were not going about their usual business. There was too much, would I say joblessness, or just sitting around doing nothing. The intimate partner violence issue we had went on increasing, like continuously. There was child abuse, children were not going out to school, and then parents were using them as for child labor. Some of these children were forced into child trade, because as I said, a child might be issued a warning for staying outside, but an adult might be arrested. So children were actually sent in to sell some of these drugs and do other stuff in place of the usual people that do this. The next slide, please. So from the consultation, DRAN, the network, was able to come up with a few ways to assist the communities with some of the grants we got from our partnering organizations. Like, first, we created and strengthened IAC platforms to promote community mobilization and to engage in community service delivery by creating a community to population hub. Now, this was like a site, an online site, where all key populations could come, only key population. There was restriction to this site, this platform being strictly for key population members. And when I say key population, it includes all populations, the MSM, the LGBTQ, the FSW, and then the PWIT population. We had a platform where we could come and disseminate information, communicate, and assist. And there are cases where we had responses to emergency situations, due to information shared in these platforms, which also helped us. And then we had capacity building for community leaders on community-led monitoring. This was as a result of our trying to engage with the CCM in our countries, the law enforcers, and then we had to learn how to keep data, how to gather information, how to do monitoring, and how to be ready for any further steps. Being also that there have been so many surveys that have been going on, but we are yet to have like direct or information that aligns to key populations being distributed. Some of this information, like from the IDPSS, from the KPISE, they were not necessarily disseminated down onto the networks, the key population networks in the country. So we had to do the community-led monitoring. So in a case of any survey or anything, community members are ready to climb back on this and then gather our own information. And then also we had grant developed IEC materials, which through this grant IEC materials, we had one that provided linkages and services based on the state and location you are. This IEC material was able to bring out contact persons and then like OSS, the one-stop shops in the different states where key populations could easily access treatment or call for services and call for engagements and help, and even for human rights assistance. Then we also did community capacity building on community policing, which is also just recently concluded. Next slide, please. Okay, more on interventions that we provided. We had community, this actually differentiated service scale up for key population. This was from, I think, Global Fund CRG grants, where we had a lot of trainings around gender and gender, which was centered around gender and human rights for women who use drugs. And then the GFHIV, which started in 2018, which was actually stopped somewhere around the COVID era. There was no interventions, there was no, I think the grant stopped around 2018, and then it resumed back in 2021, but I think proper commencement took place somewhere around 2022, early this year, about 3 or 4 months now. There's been provision of NSP in about 3 states that DRAN coordinates in 3 different states in Nigeria, and then just the NSP. Now, conversations about OSP is still ongoing. Like we recently found out that the Federal Ministry of Health, like the Nigerian government, have, I think they have an issue or so with the term OST, that's opioid substitution therapy. Now the new term that has been tabled and we're still awaiting, we are awaiting to see how they respond to it. They came up with it themselves. They said medically assisted treatment, which is MAT. So in place of OST, we are getting MAT, which also is something that is part of the NSA. As far as they'll be providing the substitution therapies for persons who use drugs, I think it's a bonus, and it's all seeing our harm reduction coming to actualization. Then we had capacity building of outreach workers on differentiated service. This was under the GIVE funds. It's still ongoing. And yes, of recent, DRAN organized the Drug User Symposium. I should give a lot of breakdown on this, but this just happened like about weeks ago. But there's a lot of information we gathered from this symposium. We had stakeholders from the Ministry of Health. We had representatives of partners and then PRs, different organizations. We have community members, a lot of them. I think in this symposium, we had over 100 participants where almost everyone had the time to make contributions. And from these contributions, we were able to come up with a few recommendations. Can we go to the next slide? Hope my 10 minutes is still on. Next slide. Okay. Now, some of these recommendations were built up from the community members and then from the views of law enforcement agency on things that were necessary or things that need to be addressed in the country. Most importantly, we all agree that there needs to be a threshold of drug possession. There needs to be a defining factor before arrest. This is one of the key things that we still have. We all recommended, and from here on, we are just going to keep trying to see how we push this forward with our government, and hopefully all West African countries will come to adopt a threshold that would help define and reduce the human rights violations in these countries. Now we have treatment, not arrest of drug user, which is harm reduction in itself, which is decriminalization in itself, incarceration of drug use distributors. We've had a table like we have the Drug Demand Reduction Committee. What they are really looking at should be on drug distributors, drug process people who sell drugs in large bunks, or drug lords. Thank you. So those are the kind of things we're pushing at. Also, harm reduction practices and access to non-stigmatized treatment and care, inclusivity, which is very important, gender processive laws and policies. We are also looking at child care and maternal safety. And something else that has come to notice is that the government keeps separating children from their parents. That's there is a belief that a woman who uses drugs cannot be a good mother or cannot, be useful to her society. So most women, when they have their babies, these children are taken away from them, which is not good. It affects a lot of women in the community. This is something we're hoping will be looked into. We also talked about supportive interventions, laws and policies protecting all human rights. These recommendations, there's a whole lot of them, but I just picked out this few. And working with my time, I think I'll stop here.
Wonderful. Thank you so much, Rita, for that amazing presentation. Such important research that you're sharing here. And as people have noted in the chat, there's a need for a lot more of this research, and especially great that you were able to touch upon the gender perspectives of all this as well, and the need for women who use drugs within harm reduction and human rights too. So really fantastic presentation. Thank you so much. And just a reminder to our attendees too, we will send all of these presentations out to you after the webinar, so you'll be able to review them again. So we're going to move along to our next speaker. Just a quick housekeeping note. So our French interpreter has been able to join us. So many of you have probably seen already that if you go to the bottom toolbar in your Zoom, you'll be able to click interpretation and click French if you're able, or if you want to use French interpretation. We apologize for the issues that prevented us from doing this from the beginning. So let's move right along now to our next speaker, Yvonne Mogere. Sorry, computer froze for a second. Well, I'm sorry. There we go. And so Yvonne is a consultant who worked with AfricaNPUD on this report on human rights violations against people who use drugs in Sub-Saharan Africa. And they'll be presenting on that report and some of the findings from it. So whenever you are ready to begin, you have the floor.
Okay, thank you. Thank you for this opportunity. As you've just heard, my name is Yvonne Mogere, and good morning, good afternoon from wherever you are. Quickly, I'm going to take you through the report and from the research and survey that we did. That was last year. And so to note is that I'm not going to read through all the report, just give highlights of the same. And so once we have the chance to or once the report is shared to all of us, we'll be able to read. And in case we have other concerns, we can really organize another meeting of this kind and get to iron out any other matters arising. Also, I wish to note that my laptop just decided to update Windows, so you may not be able to see me. I'm using a desktop computer that does not have a camera. This is the introductory. Please allow me to share my screen if that's okay. Right. Great.
Sorry, I thought that you wanted to share it. 1 second. There we go.
Please let me know if you are able to see my screen.
Yep, we can see it.
All right, so this is the report on human rights violation and COVID-19, which is a survey on experiences of people who use drugs in African countries during the COVID-19 pandemic period. Yeah, we all are aware that COVID-19 is still with us, so let's not assume that it is a period that passed. So yeah, so COVID-19 pandemic, as we are all aware, struck in 2019, and governments across the world took various measures to be able to counteract the risks of the disease spreading. The measures included travel restrictions, mandatory quarantine for travelers, social distancing, bans in public gatherings, working from home, curfews, and lockdowns, which became our new norms. So these measures had a negative worldwide effect on businesses, education, and healthcare. And as a result, there was an increased vulnerability of people who use drugs to abuse, discrimination, and violation of other rights. And so it is in this regard that AfricaNPUD, that's the network for people who use drugs in Africa, conducted a survey in August 2021 to assess the levels of human rights awareness and experiences for people who use drugs in Africa countries during the COVID-19 pandemic. Yeah, so having in mind those measures that were taken by governments in different countries, the design for this research was quite different because we could take into consideration the different COVID-19 containment measures in different countries. So in methodology, face-to-face interviews were not possible for some areas because of travel restrictions. And in that case, we allowed for phone interviews and other designs that could be appropriate in regard to each or respective countries. So we designed questionnaires that will be found attached in the main report. And in this questionnaire, we had 3 key areas which were grouped into awareness and knowledge, violation of rights, and support when these rights are violated. So to be able to achieve this, we had at least 7 questions for each of the key areas, which tackled differently and could gather information that could lead to a purposeful kind of resolve towards each of the key areas. So the methodology that we used included face-to-face interviews where possible, because if during lockdowns, if you were confined in a given area, you could be able to meet, and while being sure to take into consideration the containment measures. So we used face-to-face interviews. We also used phone interviews and focused group discussions. So each country represented by the network leaders, and this network leaders were the ones who are now coordinating our data collection from each of the countries. We had trainings on how to correct the data. We trained the network leaders, and to be able to conduct those face-to-face interviews, conduct focused group discussions, and report them either in French or in English. So those who reported in French, we were able to translate from French to English, and we were able to do analysis on the and report on the findings. So I want to quickly take us through part of the results that we found. I think this is blocking me from being able to. I'm sorry. Yeah, that's what I was looking for. So I want to take us through part of the findings, and much of it will be is documented in the main report, which we shall have a chance to read. So on awareness of human rights, we discovered that across the countries, the users or the participants or who are aware of the right to life and right to education. These were the most popular and mentioned by at least 6% of the participants. They said they knew they had the right to life, they had the right to education. And this was mentioned among 60% of the participants from across the countries, at least 60% across the countries that participated. Further, it was noted that the drug users learned about the rights from schools. So these are for those who responded, yes, they went to school up to a certain level, primary, secondary, or higher levels of education. And others mentioned that they had learned this from harm reduction organizations in their respective countries, which organized forums or sessions for educating their respective PWDs in their countries on matters human rights. So we also had a question on whether they were willing to learn more on the human rights, because one of the major issues we noted is that they are not aware of whether there is documentation on human rights in which they can be able to gather more information. Some mentioned the constitution in their countries, yes. They are not, most were not even aware of the UDHR, that's the Universal Declaration of Human Rights. And so there was expressed interest in wanting to learn more about human rights. Actually, all the respondents in all the countries responded that they needed to get forums to be able to learn more about the rights, which rights they have as drug users, because drug use really is not a human rights issue. So they do not forfeit their rights by being drug users. So on violation of human rights, yes, all the participants, this one it was quite categorical that all participants stated that they had at least one of their rights violated since the start of COVID-19 pandemic. So this, although the awareness was low from the responses, because some were saying we are facing harassment from government forces, imprisonment, nobody listened to us, we are operating in harsh conditions, we have fights in with our spouses and all that. So they mentioned that they had at least one of their rights violated during the COVID-19 pandemic, and most common among these were torture and harassment by government forces, imprisonment, and being held in police custody without any charges. And this was done in very harsh conditions. Mistreatment by spouses, by inflicting pain and injury through fights, and death threats were also mentioned. So key to point out here is that by mentioning this, most of the respondents were not aware of what to do, having not known that they have their rights, and which way should they go after their rights have been violated in any way. So most of the violators that were being pointed out across the countries were police, government forces, spouses and peers, and also local administrators. As I move to the summary, because much of these critical areas are well tackled in the report, and each country has that participated has its areas well captured. So we shall be able to go through, and this report provides documentary evidence for us to be able to work out on various measures to be able to, whether it's from advocacy projects, whether long-term or short-term, in order to, or on behalf of the people who use drugs. So we can use this report as a documentary evidence that people who use drugs for sure face, they do face daily harassments and discrimination and abuse as well. So, and good to note that these incidences go unreported because they fear reprisal or other harmful physical or legal consequences. So,
hey, Manan.
Drugs, yes.
Hey, I'm so sorry to interrupt. We just need to wrap it up in like another minute here, so we have time for the final speaker. That's okay.
All right. I'll do that quick. I'm on the summary now.
Thank you.
Give me a minute. So, so their rights are not recognized, and this is blamed on drug use. So, those are some of the implied kind of recommendations that we can draw from this. And as different networks in our countries, we can get the kind of information that we are getting from this report to be able to act in terms of advocacy on behalf of the drug users. I do not wish to take much more time. These slides will be shared, and this report will be shared across as well. So if we can be able to organize for another kind of interactive session like this, then I'll be available and glad to be there. Thank you. Back to you.
Thank you so much, Evan. Great presentation. Yes, we will have, we'll send the report out to everyone as well. The conclusion of this webinar. We'll also send out the slides as well from you too. So thank you so much. So I want to move into our final speaker here, noting the time here. I apologize that we are running up against the hour, but we have a fantastic final speaker to introduce right here, Maria Goretti-Ann from the International Drug Policy Consortium, the African consultant. Maria is going to give a quick presentation around the role of civil society, and I'm going to go ahead and pull up her screens right now, Maria.
All right, that's fine.
And you have the floor whenever you are ready to begin.
Okay, so good afternoon, good evening, good morning, depending on where you are joining us from. And thanks so much, INPUD, for inviting IDPC to be part of this conversation. So basically, I will be looking at issues of decriminalization and how that impacts human rights in terms of people who use drugs. So basically, if we are talking about decriminalization, we are looking at eliminating criminal penalties and sanctions and activities related to the use and possession of drugs. This could either be in a written law or delivered in practice, where you have situations where countries have the laws that kind of criminalize drug use. However, in terms of practice, people who use drugs are given some kind of treatment in terms of not sending them to jail. And currently, I think this is applied in over 30 jurisdictions around the world. Now, at the level of IDPC, we have what we call the IDPC gold standard decriminalization. And if you look at, the more we explore how decriminalization works around the world, the more we realize how different some of the models can be. And unfortunately, in some cases, the decriminalization model that exists have failed to actually reduce the punitive or the punishment and human rights abuses that are faced by people who use drugs, which have been highlighted by the previous speakers. With this in mind, so IDPC outlined what we call the golden standard of drug decriminalization. I know INPUD has also got a document regarding this, that all countries should aim towards in order to create drug policies that reflect the evidence and can provide the greatest outcome in terms of health and well-being and human rights and development of people who use drugs. Now, when we talk about the gold standard, what does it involve? We think that there should be total removal of sanctions, both criminal and non-criminal. That means that all drug use related offenses should not attract any criminal sanction, and that applies to all drugs. And this means that no criminal records, no fines, no detention, no community service, and no other punishment for the use and acquisition of drugs or cultivation for personal use. And I believe that this is already happening in some countries like Uruguay and the Netherlands. We also believe that in removing all these sanctions of drugs, it should be formally enshrined in the law. Why do we say so? Because we've seen countries where this is just done under the goodwill of governments, and then governments come, governments go, and once they come, they terminate some of these things, and then we go back to square zero. So this provides a greater security and sustainability of the policy, and this is what we call the de jure decriminalization, as opposed to the de facto, which can change anytime when a government comes to power. We also believe that there must be, when we're talking about decriminalization, it should promote voluntary access to all the evidence-based drug policy services, such as harm reduction, social services for persons who use drugs. And the drug, changing the law alone will not address all the harms and challenges faced by the people who use drugs. What we need to do is that the use of the golden opportunity to create a supportive environment with well-funded voluntary and accessible services as harm reduction is very key in this. And I believe that in decriminalization, treatment should not even be compulsory or coerced. The entry into treatment should not be sanctioned, and the fact that somebody goes into treatment and is unable to complete should not be punished for that purpose. Crucially, I think the gold standard of decriminalization means that we need to acknowledge and address the damage that previous drug policies have caused to individuals and the entire community. And that means that if we are decriminalizing, then we have to remove all previous convictions. So for instance, if a country should decriminalize, then we have to move to make sure that we expunge criminal records of persons who have had some kind of conflict with the law previously. And by doing so, it helps us to be able to give the opportunity of persons who use drugs the space to be able to access certain things like housing facilities and all that. And this direction is already being taken by some other countries, like for instance, in the US, we've seen where recently some criminal records have been expunged, and recently Thailand in relation to cannabis reform. Now, to ensure that decriminalization is accompanied by comprehensive training and sensitization, we have to aim at the relevant public authorities. Because even if we decriminalize and law enforcement officers and judiciary are not trained or given that necessary match to change behavior and attitude on the ground, then decriminalization cannot achieve its full potential. So there's need, as we move as countries towards these directions, we need to make sure that we do this. And we also need to make sure that we direct funds from criminal justice, the criminal space, and then law enforcement in response to the health and social services. And I believe that in doing so, that will help us to be able to make available the needed resources for persons who use drugs. In terms of, because of time, I'll try as much as possible to be very brief on some of the things so that once we have the slides and the question and answers space is open, we can address that. Now, as I earlier mentioned, in terms of benefits of decriminalization, I believe that decriminalization, if it's done right, it can help to end damaging impacts of the criminalization, because criminalization is one of the impediment to many of the achievements of some of the things we've been advocating for, whether human rights violations, health, access to health and all that, is as a result of the criminalization and criminal environment that we've created around drugs. And so by decriminalizing, we are creating an enabling environment for people who use drugs to be able to do so. And by doing so, we also reduce the human rights abuses that people go through. And like Rita rightly mentioned, last year, AfriLaw, and in collaboration with IDPC, undertook some study in Nigeria on ill treatment and torture. And it amazes you how people who use drugs are subjected to some kind of dehumanizing treatment. And it's all because about the law. I mean, people think that they are waging a war on drugs, yet it is individuals who are the main people who suffer these consequences. Now, in terms of how decriminalization can impact human rights, I believe that if it is done right, like I mentioned much earlier, the golden standard, it will help us to promote the rights of people who use drugs, because people can access health services. Because so long as the environment is criminalized, so long as people who use drugs are treated as criminals, it prevents them from coming out to be able to access health services. I've seen instances where even in some countries where harm reduction is being implemented and the laws themselves are still punitive, that stigma, that high rate of stigma among people who use drugs is still there. And so it doesn't give them the opportunity to be able to really fully access some of these things. And I believe that when we decriminalize, it also helps us to ensure a more humane and effective response to the needs of people who use drugs, as well as how to access services available to them. Now, if we also decriminalize, it will help us to also direct or enhance funding for services, because too much money, I mean, the evidence is there for all of us in terms of how much is used in policing, used in law enforcement, especially on the small fries, like people who use drugs. So I believe that if we decriminalize, that will help us to reduce some of this and also put in resources to be able to put in services that people can also access. And more importantly, stigma is one of the issues that is driving a lot of people underground and unable to access a lot of services. And so when we decriminalize, it creates an enabling environment. And also it's a way of sensitizing communities to appreciate the fact that people who use drugs are not different. They are just ordinary human beings like any of us in our society. So of course, it will help us to be able to reduce stigma significantly. And also, it also helps to tackle the corruption and abuses of, I've seen in countries where, even in my own countries, where police officers will always go on soups, and anytime they go, it is about monies being extorted from these people. The people who are not able to pay these monies are the people who end up in the prisons, and they are the people who face the law. Next on the slide, please. So basically, if you look at the work of civil society and what we can do in terms of supporting community leadership, I believe that civil society organizations play a multiple role in the work in terms of advancing humane drug policy within communities. And so by doing so, I believe civil society can create safer space for people who use drugs to access treatment and harm reduction services through the advocacy work we do and engaging policymakers for the need to reduce, to change laws and policies within our countries. And by doing so, I believe that civil society has the mandate to empower communities on harm reduction practices, and also supporting grassroots leaders to build representative platforms where they can directly engage with policymakers at national level. I remember Rita in her presentation was talking about the need to for civil society to be able to document some of this, and I believe civil society's role within communities to encourage grassroots leadership to document some of these, because sometimes when you speak about these things with policymakers, they tell you that we have not had reports about people who have been violated or people who have been tortured. I remember when we launched the report in Nigeria on torture and ill treatment, policymakers who were there appreciated and said that, yes, this is a document we can run with because we now have the data, we now have the reports. So civil society can encourage leadership within the grassroots to document some of these things that happen within our society. And I believe that having these documentations help us to really push further for the cause that we've all championed. Now, next on the slide, I want to share a lot of the free resources that from here we can all read and also access them and then know more about what decriminalization seeks to address. Especially, I've seen instances where countries are a bit adamant in terms of the conversation around decriminalization, with the belief that it's going to create a free-for-all drug use within the continent and all that. But we all know that that's not the case. So recently, IDPC launched its e-course, and this e-course is free. It's in English, in French, Arabic, and Russia. And I believe that there will be other languages that it will be translated. So feel free to visit the site to access these these resources. We also have the decriminalization guide for advocacy, which was launched this year. And then also more importantly, INPUD has also got a document that on decriminalization titled Progress or Political Red Herrings, which was launched last year. It's a very great document that gives you as an advocate how to probably make arguments for decriminalization of persons who use drugs. And then also the global drug decriminalization map, which basically kind of highlights where decrim has taken place, what kind of decrim methods, and probably guidelines as to how all these things are done. On this note, I want to end here, and probably if there are questions along the conversation, then I will be happy and glad to address them.
Thank you so much, Maria, for that fantastic presentation. And we will send along all these resources to everyone as a follow-up to the webinar after the end of this all here. So thank you so much for being here, and thanks for the work of IDPC and pushing decriminalization in the region and educating people on it, as well as with advocates and people new to the concepts. So I know that we are already over 10 minutes time here, and I want to thank everyone for being so patient with us as we worked through a couple of technical issues during this hour, and don't want to keep people for too much longer. We did just want to give the floor very quickly here for a final intervention to end our discussion today. Oh, sorry. Oh my God, sorry, I'm having some computer issues. There we go. So I just want to end with this intervention from the UNODC Africa Regional Officer, Samaran Rangaswamy. I apologize if I pronounce your name wrong, Guna. But I just want to give you the floor for a couple of minutes here to make any comments you'd like to make on behalf of the UNODC as we wrap things up here.
Okay, thank you, Jake, for inviting me for this webinar, and thank you, colleagues, and nice to be here with all of you. My name is Gunasekaran Rangasamy. It's a little difficult to pronounce, like Jake was struggling. So you can remember me as Guna. Many of the colleagues in the call know me. I have worked a lot with Maria, and Ansela is here. I saw her, sharing comments in the chat box. So I was earlier with Western Central Africa region based in Nigeria, and very happy to hear a lot from Rita about the kind of work that's happening in Nigeria these days. So I was there in Nigeria from 2013 until 2018 as a regional advisor for Western Central Africa. When I went there, the situation was very different. Using the word harm itself was harmful to a person using the word. That is how it was at that time. So things have changed a lot, and a lot of engagement with the Global Fund there, and even UNODC is acting as a sub-recipient now. And hopefully OST will be implemented soon. So, and we have a lot of collaboration with INPUD, IDPC, Mainline, and a lot of other harm reduction networks in the region. I'm very happy to be part of this webinar, and happy to collaborate more with the African network of people who use drugs. And as you know, as part of the UNAIDS Secretariat and the family, we are mainly concerned with the drug user issues when it comes to people who use and inject drugs and people who are in prisons. So many a times, people who are using and inject drugs in the community gets a lot of attention, but sometimes people who are in prisons get very minimum attention here. So what we do a lot of work with regard to reducing punitive laws. We work with the law enforcement agencies. So we work towards removing punitive laws and also limit the use of punitive laws in the community or anywhere. And we are also working a lot with regard to stigma and discrimination. And we also really work a lot to improve gender equality. We are here after several years of harm reduction programs in the community, but in many countries we do not have programs that happens in prisons. This is the real scenario, and on top of that, we do not even have programs for female, drug users in prisons or females in prisons. So we really work everywhere with the national government, state AIDS control society, national AIDS control program, drug control authorities, correctional services, in terms of really bringing them all together in developing very inclusive strategic plans, very inclusive prison action plans, very inclusive plans that will include people into getting access to services. Recently, we have been engaging with a couple of countries in the region. I just want to mention this here through a webinar to promote harm reduction. We have already done a webinar in South Africa, Tanzania. We are planning one in Zimbabwe very soon. So we bring, this is done in collaboration with the Global Fund and WHO, and with other regional partners like Mainline, or with any harm reduction network in the region. So we bring policymakers who matter much to bring in change and bring all stakeholders to the table for them to be able to really talk face to face, and get their issues raised. So sometimes it really, we also take a lot of action points from these kind of webinars and follow it up. One of the offshoots of the recently conducted webinar in Mozambique, I just want to mention, is like the government, the AIDS control program, and everybody's interested in going and seeing successful programs in countries where opioid OST is successfully implemented. For example, like in Kenya, a team is visiting Kenya shortly to see the programs there. So this is the kind of intervention that UNODC is very much involved in. And we are doing a lot of work with correction services. And I want to urge all the networks to also really connect with the UNODC colleagues at the field level, and so that you have a lot of convergence of activities in the region. So thank you very much, and let me stop here, and over to you, Jake.
Thank you so much, very much, Gunnar, for being here, being a part of this event. Great to hear from the UNODC on all of this and the work that you all are doing in the partnerships being formed. So thank you so much for being here and for including our webinar today. I want to thank again all of our wonderful speakers for being a part of this. We will definitely make sure to be sending your presentations and other materials along to all attendees. And I want to thank all of you attendees for showing up and being a part of this great event here. We will have a lot more to talk about regarding human rights and people who use drugs in Africa moving forward. Check out AfricaNPUD, its website and social media platforms for further updates. Check out INPUD. We'll send along all this in the follow-up email. And yeah, don't want to take up too much of everyone's time. So just want to thank everyone again for being a part of this, and hope everyone has a great rest of your day and your week. Thank you.
Thank you.
Hey, Jake. Anyway.